Blood tests are an essential diagnostic tool. Blood is made up of different kinds of cells and contains other compounds. Blood tests reveal details about these cells and compounds. To be as simple as possible, a small sample of blood is taken from your body and is analyzed. The part of the blood that is usually looked at is the plasma or serum. This fluid is used to measure different substances in the blood. Also, the whole blood can be looked at to count blood cells. To start off with the basics, why do we need blood tests? Blood testing is utilized to find diseases, allergies, HIV, AIDS, hepatitis, cancer, and a lot of other things. Also, we are able to see the vitamins we are deficient in. Blood testing is essential in knowing how healthy we are. This is how a blood test is performed. First, a tourniquet is tied around the upper arm because the blood is usually taken from the veins around the elbow. The tourniquet makes the veins prominent. Then the site of the injection is cleaned. Lastly, the hollow needle is put into the vein and the blood is then drawn. During a live blood cell test, we can actually see the technician analyze our cells. They put them under a microscope and we can look at them through a monitor. So the question is, how do we know the difference between healthy and unhealthy blood cells? These are normal red blood cells. This is what our blood looks like when we are experiencing optimum health. Protein linkage means that we are consuming too much protein or it is not being completely digested. When cells start sticking together like this, it gets harder for the heart to push out blood through veins and arteries. Also, protein linkage can progress into rouleau. When the blood gets to this condition, the amount of oxygen that can be transported is severely diminished. This condition is caused by high fat and protein diets and high acidity. Your blood will look like this if you drink one soda and will stay this way for at least 2 hours. Because your cells are not getting oxygen, you will feel tired, have poor digestion, and skin disorders. Erythrocyte aggregation is one step worse than rouleau. This is often seen in people with degenerative diseases. This is caused by undigested fats and proteins and high acidity. Degeneration of tissue always follows low oxygen and acidity. This condition can precede a blood clot, which can cause a stroke or heart attack. Poikilocytosis is caused by free radicals. This also lowers the blood's oxygen carrying capacity and shortens the life of the cell. RBCs don't have nuclei, so they will not mutate, but the fact that there is free radical damage signifies that there will also be damage to the nuclei of tissue cells, which is the beginning of mutations that lead to cancer. Microcytes have less hemoglobin than normal cells and is often seen in people with iron deficiency anemia. Anisocytosis is mostly seen in people with low levels of vitamins B12 and folic acid and the mineral iron. Hemolysis is literally the destruction of red blood cells. This can be caused by bacterial infection or any number of toxins introduced into the bloodstream. The hemoglobin goes out of the cell's interior and diffuses into the plasma. This can also be caused by hypotonic fluid injected intravenously. Death will follow if not corrected. Plaque is one of the most dangerous conditions in the blood. It can adhere to the artery walls, narrowing and hardening them. These crystals are formed when the system becomes acidic and the fatty acids from simple carbohydrates crystallize. Uric acid is a byproduct of protein metabolization and urea. When the body becomes acidic and the urea forms crystals that can lodge into the joints or in the tissues, uric acid is the cause of gout and one of the causes of fibromyalgia. These crystals are shaped like knives and is the reason it can cause so much pain for people with either of these disorders. Cholesterol is an important sterol in the body that is the precursor for many important hormones. Only when the body is acidic does the cholesterol crystallize and become a problem. This is probably the most seen crystal in blood analysis, but it's important to realize that cholesterol is not the problem when you see crystals, acidity is. In conclusion, it is important for everyone to get live blood cell tests done because it keeps us aware of the shape our bodies are in. Thank you for listening.